Ladies and gentlemen, World Hypertension Month alerts all medical practitioners to the importance of proper diagnosis and effective treatment. In our commitment to public health and professional service, IPCA proudly presents a daily take-home message throughout this month. These insights are provided by the eminent Padmashri Dr. C. Venkata S. Ram, a global legend recognized for his pioneering contributions to our understanding of hypertension. Listen to Dr. C. Venkata S. Ram's today's message.
Greetings to my fellow medical practitioners all over the country. In connection with the World Hypertension Month of May, the message for today is regarding hypertensive emergencies. In the last few days, I talked about routine treatment of hypertension. I also talked about hypertension in some special circumstances such as chronic kidney disease. I also talked about secondary forms of hypertension. Today, I am going to comment on hypertensive emergencies. The guidelines do not use the word hypertensive urgency anymore. So, whenever severe hypertension is associated with acute target organ damage involving the brain, the heart, or the kidney, the term is hypertensive emergency. The definition of hypertensive emergency is when severe elevation of blood pressure causes acute target organ damage to the brain, namely hypertensive encephalopathy or acute stroke, to the heart, namely acute heart failure or acute coronary syndrome, or to the kidney, namely acute kidney damage or worsening of chronic kidney damage, or acute aortic dissection. So, whenever the elevation of blood pressure is high enough to cause damage to the brain, to the heart, to the kidney, or to the circulation, it is called hypertensive emergency. So, the definition of hypertensive emergency does not necessarily depend on the level of blood pressure, but it depends on the status of acute target dysfunction of the brain, the heart, the kidney, or vasculature. All hypertensive emergencies require hospital admission. They should not be treated as an outpatient. And the drugs that are used in the hospital are familiar to you, namely either sodium hydrochloride and nitroglycerin or labetalol. These are the intravenous antihypertensive drugs that can be used to lower the blood pressure quickly within a matter of few minutes or hours in the case of hypertensive emergencies. So again, in summary, the definition of hypertensive emergency does not depend on the level of blood pressure, but on the status of the brain, the heart, and the kidneys, and they should be treated with intravenous antihypertensive drugs in the hospital setting to reduce the level of target organ damage and to also reduce the level of blood pressure. So it is an important distinction you have to make between hypertensive emergencies and uncomplicated hypertension. In hypertensive emergencies, there is acute damage to the brain and to the heart, and you have to reverse it by immediate lowering the blood pressure in the hospital setting, in an intensive care unit, by using one of the intravenous drugs that I mentioned, namely nitroprusside, nitroglycerin, or labetalol, and bring the blood pressure to safe levels of blood pressure.